And I think, like I say, I think we're live.
Woo! How are you?
I am better. That little flu bug got me pretty good. I ended up staying home. As you know, I didn't go in on Monday. We're calling this the Abby virus.
Yes, the Abby virus. Like a hurricane, only a virus.
You know, I tell everybody, I didn't get a chance to give you guys a proper goodbye, and I'm so sorry about that. But I was worried about, giving you hugs and things because I didn't want you to get sick. I knew Wink had already had it the day before, but Abby'd been we had such a whirlwind week with you being here, and then we had Gonzo having a little baby boy, and we want to share all those pictures, but she's been having a little bit of a rough time since the delivery, and she hasn't had a chance yet to put all those pictures up, and I know she wants to, but when she's done, we'll have some pictures of baby Gonzo, but and with us all, with Abby being in the emergency room twice, and we're thinking that she had possibly appendicitis, and it turned out she didn't. She just had a really bad stomach virus, and then Wink got sick after we went out on the boat, and then my Sunday was wiped out after church. I couldn't even get through a reasonable small stack of pancakes. What a waste that was, right?
Yes.
And then I ended up in bed, achy and fever, and just exhausted and sick feeling all day on Sunday, and then you guys had to go back. So here's a virtual hug. I mean, love you guys. You're awesome. So this is so I really wanted to get a chance to just kind of let everybody know how you're doing. You're not moving. There you go. You're moving now. So we have a little storm front that's kind of coming through here, so we may be in and out a little bit, but we'll make the best out of this. And I think everybody understands you're on the other side of the world, just about from us, and so we're going to take what we've got. So how you feeling?
I'm feeling amazing, actually. I'm feeling some energy, like loads more energy than I had before.
Yeah.
But I hadn't realised that. Although I was all positive and full of energy, and I think, my fans would say that, it had become my new normal. So, I think when we were out at the restaurant that night, which restaurant was it? I got a bit animated at the table. The steakhouse. That's
yeah,
it.
Roadhouse.
It was like Sue back in the room. So
yeah.
I'm up here with the energy now.
Right,
so
good.
You ain't seen nothing yet. Yeah, so I think that's the poison out of my body, and my body's not fighting an infection. All it's doing is knitting together and, growing the tissue back together and healing rather than fighting an infection. So I feel really good in myself, loads and loads of energy. Haven't even got any jet lag, which is really good. Little bit painful today.
Yeah.
More painful than before, I think, but I don't know if it's at a different stage of healing or not. But I still got some killer painkillers left, a couple left.
Good.
And I've still got some antibiotics. I've got 4 of the rifampin.
Yeah.
Get that right?
You did. You did great.
Finally learnt it. And I've got 10 of the other ones that I can't remember what they're called.
Were they the trimethoprim sulfamethoxazole? Were they?
Yeah. That one.
We need Wink to make a song, write a song, and include that word somewhere in the song. Would be really awesome. You want to show everybody where you are now with the wound?
Yeah, sure.
Okay.
You want to take a look?
Yeah, let's take a look.
Okay, I'm just going to drop the camera down so that you can see my back rather than my shoulder.
Okay.
Is that in a good place?
Oh, that's wonderful. That's great.
Okay. Nurse Wink.
All right.
Dr. Patel had that problem when he was trying to put the dressing on. He was just like, the most difficult bit is trying to find the end.
Right, absolutely.
With the rubber gloves on. So.
Okay, lean back just a wee bit for me, and then stay really still. Okay. Well, yeah, it looks like you've got a little redness. You've got some purplish around. I think that's some bruising. We can't be very far away from needing to, think about taking out stitches. Did he say you wanted to wait 3 weeks, right?
Yeah, that's right.
Yeah.
3 weeks from last week.
So, Yeah, I think now. How often are you sending a picture in to Dr. Patel so that he knows kind of how you're doing?
We haven't actually sent one yet.
Okay.
But I think maybe I should do that. Take a picture of this one tonight.
Yeah.
I took pictures last night, which I think I actually emailed to you today.
You did, and I'm going to send it over to our guys that do a fantastic job of editing my videos and ask them to work in like a before and after, because the picture that I have looks much better, and I think the lighting is kind of playing into this a little bit. It really looks bruised and irritated. So let's get a different. I think the angle is kind of playing into this, because the picture that you sent me from earlier looked. Go ahead.
Does it look any better if she turns slightly like that with the light?
Yeah, actually it does. Yeah, as a matter of fact, it does. It doesn't look nearly as bad. So I think you're right on track. We have to be definitely on infection patrol, because we do know that you had a resistant infection, and there's always that risk when you have a closed infection that there's the possibility of a recurrence of the abscess. I think the good thing, though, even if that happens, is that we can pop a stitch and just let it drain a little bit, and it should go ahead and heal. Because I'm fairly certain that Dr. Patel removed all of the scar tissue and the sac material and all of the related gunk, so to speak. So that's good. Okay, so you can put a dressing back on it, so we can kind of Thanks for doing that.
No, that's cool. He actually said that he'd got absolutely everything out.
Wonderful.
He got all of it out, and it was not cancerous, so that was good.
Yeah.
Always a bonus.
Oh yeah, it's always nice when it's not cancer, right? Absolutely.
Yeah, absolutely. I'm just going to put this up again so that there we go. Yeah, so that was a bonus. And he talked about popping a stitch as well, if it would need to be. And he said, if it gets red around it,
right,
to phone him straight away,
right,
and then take a view on it. But Wink's going to take the stitches out. He's shown them how to take the stitches out. Mm-hmm. And we're going to do a FaceTime, so he's going to be there with Wink when he does it.
Wonderful.
Yeah, Wink's going to cover that up.
There you go.
We need to see a plaster going on. So that is really good. And I think today it felt painful kind of deep in, because I know he had to cut right down to the muscle, because the cyst was kind of attached to the muscle wall, so he kind of had to go right down there. So I don't know if it's that sort of healing from the inside.
I really think that the fact that he had to cut into the muscle is probably why you're having the pain that you're still having, because the muscular tissue takes a lot longer to heal. Typically with a skin infection and a wound like that, if it doesn't involve any muscle, once you remove the other material, the pain is very, very minimal. Most patients only need pain medicine for just a few days at the most. This has gone on longer for you. What now? 9 days or so, right? Something like that.
Yeah.
And because you've been home now since Sunday sometime, right?
Monday.
You got back Monday, right? So this is Wednesday. So yeah. So
this is day 9.
Day 9, right?